My name is Dr. Vanessa LaPoint. I am a registered psychologist, and I work primarily with children and their parents, often with children who have learning differences. So the early signs of dyslexia can be very different depending on the child. Usually development is sort of carrying along as we would expect in the very early years of life. You might see that there was maybe like a slight delay in terms of language development, or a slight delay in terms of some kind of sound issues as far as how the child is hearing language and how they're producing language. But oftentimes you have no sign of it whatsoever until your child has landed in a mainstream classroom. Within that classroom, usually what happens is there starts to be the experience early on of the child not being able to keep pace with their peers in the way that you would expect, given what you know about your child and their potential and how clever they actually are. Sometimes what we can see is that there'll be behavioral challenges that begin to emerge for the child. Sometimes those challenges are externalized, and so they'll start to act out, putting up smoke screens, being the class clown so that nobody can see they don't actually know what's going on behind that. The other way that that can go is they begin to pull into themselves and withdraw and shut down, and so you start to lose maybe some of the sparkle or the essence of who you know your child to be. And you can start to see differences in terms of their behavior and functioning at home, and so you might see some challenges around anxiety or behavioral difficulties as they act out the disruption of the school day. As they carry on in their educational experience and the learning demands become more intense with the passage of the years, then you might see that they start to verbalize things like, I'm stupid, I can't keep up. You might see that they can speak about big, fantastical, amazing ideas, but are incredibly challenged to put those ideas to paper, or have all of these incredible ideas, and when you give them reading or literature that would be sort of at that level, that they can't read that either quickly, or if they are reading it, that they're not really understanding what they're reading, and so they need a lot of support to make it through that material and come out the other side having actually internalized what was in that writing. And so you'll see these different sort of pieces happening, and oftentimes it can be elusive. You'll find there are moments when your child really delivers and you think, okay, perfect, we're on, this is happening. And then the next day or the next week, something similar will present and they won't be able to follow through, or they won't be able to show you that they've understood. And then you think, we're back at it again. What is happening for my child? So when you start to sort of see those kinds of things emerging, and you can see that your child is struggling, it's at that point that we would often recommend that it might be time to sort of take a deeper look at that. When a child's learning needs are not championed in the way that really resonates with how they learn, the difficulty is they don't get to be seen and heard as the student that they are. And when they're not seen and heard as that student, then they don't get to actualize to their fullest potential. And so we start to see them drop off. Of course, you're not going to continue to bang your head against that brick wall as a student. The definition of having a learning disability is that you are average to higher intelligence, and you aren't able to bring that to play in the classroom. So they're smart kids. They look around and they think, this is not for me. And you'll start to see them often check out of the learning process, not be engaged as learners, and develop, sometimes mental health issues and other things around that. The mainstream classroom was designed with a purpose, and that was to educate the masses, which really is the middle 50, maybe 60% of the population. On the outer edges of the normal curve, you have kids with learning differences, kids with learning disabilities, learning exceptionalities, and in order for them to learn, in order for them to become what they were intended to be, they need to be taught in a way that speaks to their learning difference, not sort of squished into a standardized approach to education. I think you have a few options. I think the first thing is to look at if there's sort of outside supports that you can be bringing in or putting into place in order to support your child along. I think making sure that you're having very direct, very specific conversations with the learning support staff at your child's school to make sure that they're on board and they have eyes on your child, and that there's a program being put into place that really is responsive to your child's needs. But the bigger piece is that most traditional mainstream learning environments are not, unfortunately, able to deliver in the way that our kids really need to learn. And it's not for lack of trying. I have met so many incredible educators within the mainstream system who have hearts of gold and desire to really make it happen for kids with learning differences. But the truth of the matter is that sometimes it's just not going to be possible. And so looking to a specialized learning environment where there is targeted programming and instruction that really does come alongside the needs of kids with learning differences is key. A psychoeducational assessment is a very specific kind of assessment that is meant to look at two primary areas of functioning. The first is cognitive ability, or how the brain uses information to solve problems and understand the world around, and then communicate back to the world around that understanding. The second part of a psych ed is looking at a student's learning within a classroom, so reading, writing, and math, and trying to understand, does the brain part of things, how smart or clever or intelligent the child is, line up with how they are doing in the classroom. And so we are looking to see that there is that match, and if there starts to be a drop-off in terms of the academic skills as compared to how bright the child is, it's in that drop that we find these learning exceptionalities or differences or disabilities. And when children have those differences, often that's a cue to us that they need to be taught in a different way. We know that they're capable. We know that they can handle it. It's just not happening for them in the same way as most of their peers. So dyslexia is when, as a human being, you are not able to show through mainstream instructional methods your ability for learning and communicating, whether it be in the written form or being able to read other people's communication, that you're not able to bring that to bear in the same way that you can think about big picture things. So when you're bright and you struggle to read and write, we typically have classified that as dyslexia. So the benefits for kids attending a school like Fraser Academy happen to be multi-layered. The first is that school-wide there is developed programming and culture around learning exceptionalities. And so the whole school walks and talks a certain language and walks and talks a certain programming that transfers from student to student and from educator to educator, having the children really be able then to just kind of snuggle into and settle into a way of being as a learner in Fraser Academy. The next important layer is that the individual students' needs are carefully considered and programming around those needs is put into place. So every single child has individualized attention and instruction in terms of their particular learning needs based on a very thorough review and look at things like a psychoeducational assessment, admissions assessments, and those kinds of things. And so every sort of aspect of the child's learning is taken into account as that individualized instruction is put into place. And then all of that translates into yet another layer, which is at the level of the classroom, where there are very small class sizes and teachers who are very aware of each individual learner's needs and able to sort of tailor instruction and adjust teaching accordingly. And then the curriculum, of course, plays out and is taught in a way that really comes alongside the learning needs of kids, which is quite different from how you'll see mainstream instruction occur. So if as a parent you see that your child is bright and you see all of this potential existing in them and it's not translating in the classroom, and further, this functionally is beginning to impact your child, don't wait. Do what you can to jump in right away, get an assessment done, not for the purpose of applying a whole bunch of labels to your child, but rather for the purpose of really understanding what your child's learning needs are so that those needs can then be championed. And I will tell you personally as a parent, if there's one mistake that I feel I made along the way, it was not getting on it sooner. And I think a lot of parents probably have that experience. So be fierce and get on it, because it's the best thing that you can do for your child to have them be understood in that way.